I am Dee Meyer, software engineering candidate. I wrote my thesis about leveraging wireless sensor networks and smartphone technologies to bring about an ubiquitous healthcare delivery in disaster areas. My thesis statement is the implementation and adoption of ubiquitous technologies in disaster medical delivery could save time, money, and lives. This is a brief historical overview of the roles of telecommunication in medicine. In the early 20th century, wired telephones and telex machines were used for message exchange in the medical field. Emergency medical situations were called in or a telex was sent with a brief text message. In the 80s, the fax machine took the place of the telex and copies of medical documents were sent. In the 90s, wired computer network technologies were used to relay medical information, mostly in form of emails with attachments. In the 21st century, telecommunication technologies that could transmit and receive medical signals and data are bringing about rapid changes on how medical information is exchanged. The advent of mobile phone and lately smartphone had raised the hopes of a lot of scientists that we are moving to the realm of ubiquitous computing. What is ubiquitous computing? Mark Weiser wrote the seminal paper about ubiquitous computing while he was working for Xerox PARC in 1988. He states that it is about interconnected hardware and software that are so ubiquitous no one notices their presence, enabling people to focus on their task and human interaction. He added that ubiquitous computing envisions a world of fully connected devices with cheap wireless networks everywhere. He talked about embedding hardware and software in everyday objects connected with wireless networks that justifies the use of the phrase anywhere, anytime computing. This is a graphical representation of a simplified ubiquitous healthcare delivery network using wireless sensor networks. Wireless sensors in the sensor networks are attached to a patient, representing different medical devices with specific medical applications. The sensors wirelessly transmit the information gathered to a gateway sensor, which connects to a specified or ad hoc network infrastructure, which relay the data to a base station. The base station is supposed to be manned by a medical personnel who can either analyze the data and transmit back medical advice, or someone who can disseminate the data to an expert who can help the patient. This simplistic network configuration belies all the complexities involved in the design, development, and deployment of a real disaster healthcare delivery system. We have seen in the last slide the abstraction of a wireless sensor network. In this slide, we have a picture of a wireless sensor node or a mote. A mote is a miniaturized sensor node. The mote in the picture is a Mica Z. The Mica Z and the Mica 2 DAT are the most common motes used for medical applications for their wireless, low mass, low power, and reprogrammable capability. A wireless sensor network is formed by scattering a number of sensor nodes in the target area to form an ad hoc wireless network of nodes that could facilitate data transmission by multi-hopping. These are some of the studies that were done in ubiquitous healthcare delivery. Code Blue from Harvard pioneered the study of wireless sensor networks technology with different medical applications in remote setting. They used mostly off-the-shelf hardware and wrote specialized software to develop a remote medical delivery system. ModeCare is patterned after Code Blue, and its focus is on monitoring the elderly and disabled in their homes. They use medical management tools that measures key medical factors such as blood pressure and an alert system that activates when dangerous threshold is reached. WSN seems to have taken over where Code Blue left off, and some Code Blue collaborators are involved in this project. WSN's focus is on patient monitoring in hospitals and disaster scenes. The barriers to ubiquitous medical delivery adoption and implementation could be categorized into technical and social issues. Under technical issues, we have limited power communication and computation, lack of standards integration and interoperability, lack of reliable communication network, lack of dedicated medical infrastructure, and under social issues, we have usability factors, medical standards and policies, privacy and security, and lack of reimbursement for ubiquitous medical services. Smartphone technology and wireless sensor networks could be a formidable pair in making ubiquitous medical service delivery a reality. Cell phones are everywhere, and now smartphones are becoming omnipresent as well. Spyglass Computing writes 94% of physicians use smartphones to communicate, manage personal and business workflows, and access information, including medical reference materials. That translates to physicians will not need a lot of training if a smartphone is used as a personal medical server in a remote disaster area. Here is a sample scenario on how a smartphone could be used to transmit and receive biosignals and other medical data from the disaster site to a base station or nearest hospital. It shows a configured smartphone that could receive data from the medical devices attached to a patient and transmit them to a group of medical experts who could give immediate feedback to the medical personnel on site. In a remote disaster setting where cell towers and other network connections are either out of commission or simply inexistent, wireless sensor networks and satellite connection might be the only solution. Remember Star Trek? Remember the medical tricorder that the Star Trek medical personnel waved like a wand to diagnose and cure the space crew? Our technology is not quite there yet, but I got a feeling that the medical tricorder of the future will look so much like a smartphone. Since it takes between 5 to 10 years from concept to publication, the published literature referenced in these slides may not be the most recent. This presentation was done to inspire the audience to dream, explore, and create. In summary, ubiquitous medical delivery will be part of our future. This is an exciting time to be involved in the technologies and disciplines that will make it a reality. The worldwide climate changes may result in the increase in natural disasters. This is the time to start investigating technologies that can be leveraged to save time, money, and lives when disaster strikes. The relentless advances in wireless network systems and smartphone technologies will be beneficial in the efficient and effective disaster medical delivery. It could also make the realization of ubiquitous healthcare delivery and administration a lot faster than what most scientists expect. A lot is still need to be done before we will see the adoption and implementation of ubiquitous medical delivery system. We need more research in the disaster medical delivery using wireless sensor networks and smartphone technologies, in the changes to the existing medical policies and procedures, in the security and usability issues, and in the justification of reimbursement for ubiquitous medical services providers. I would like to take this opportunity to thank Dr. Robert Hoyt, my mentor, for his guidance, time, and patience, and the UWF's Computer Science faculty and staff members who made this journey exciting and memorable. Thank you, everyone.